Hey y'all, I'm Bonnie with Dandelion Babywearing, and today I would like to talk to you a little bit about dad wearing. So before we get started, I just want to acknowledge that not all caregivers identify within the gender binary. And if that's you, you are welcome here. And I would love to help you find a carrier that is right for you. I would like to help all caregivers find a carrier that is right for them, because if you've heard any of my videos, you will know that I do not believe that there is one best carrier. The best carrier is the one that fits your body, fits your baby, fits your lifestyle. So I'm going to be talking in very broad generalities today, and specifically about what I have found to be barriers that cis male caregivers face, and some of the things that I have found to work for them. The first barrier that I have found that is unique is just our cultural gender role expectations. So wearing tends to fall into the female role expectation that we have. And so that in and of itself, wearing is sometimes a barrier. What I have found is that a lot of times the carrier companies, in order to, because they have found out that men actually are wearing, they will sell carriers that look like they will appeal to men. I find that men gravitate towards certain carriers a lot of times because that's what we've seen on TV. Movies, commercials often have dads wearing specific carriers. So the first thing that I want to do is just challenge that. This is my middle finger to the patriarchy. And one of the ways that I think that patriarchy and our strict gender roles and expectations really hurts men as much as it hurts women, because it narrows the options that men have to use. And I'm going to kind of talk about that and show you some different options, both within the types of carriers that men tend to gravitate towards, and then ones that I have found that they oftentimes like if they are willing and open to looking at some different options. So the first main barrier, that's the first main barrier, just cultural expectations. So the second main barrier that I find is that the vast majority of baby-wearing carriers are designed for an average cis female body. So that works for me. I can wear pretty much any carrier that's on the market. Doesn't mean it's going to fit me or it's going to be the best carrier for me, but I have a lot of options. So again, this applies not only to dad identifying caregivers, it also women who have long torsos, women that are tall. I've worked with tons of body types and run into this often because these carriers, especially the soft structured carriers, are generally designed for the average female body. Let me show you how that works. So this is a soft structured carrier, a buckle carrier. This one is a Lenny Lamb, and it is one of my favorites. But the belt goes around the waist. The straps come up here, and then the clip is there. So if we have baby in here, this works really well for me with my torso length. Baby, when they get to be the size that they fit into this carrier, head's going to be up here. That's going to be close enough to kiss. That's going to be close enough to monitor their airway, monitor their positioning. It's going to work great. If I had a longer torso, if I was taller than I am, then this would all shift down because it is designed to be worn on the hips. That means baby's going to be lower. It's going to be harder for me to monitor their airway, monitor their positioning, and it's not going to feel right because baby wearing should mimic the way we hold in arms, and we don't hold baby's low on our chest. So the other thing is this puts the weight, because of the waist belt, this puts the weight around my hips. That works for me because as a woman, my center of gravity is in my pelvis. Cis men's center of gravity is in their chest. So this is not going to feel the same on a man as it is on a woman. So oftentimes I talk to dad identifying caregivers. They tell me they don't like wearing. When I dig a little bit deeper, I find out that it's actually maybe not that they don't like wearing, but they don't like wearing in the carrier that their female partner has on hand. So let's talk about some of the carriers that do work really well for men. So one of my favorites is what a lot of us refer to as an old school Bjorn. So these have been around for a long time, and they are really excellent for men, especially in the early stages when baby's really small. So these, if you notice, there's no waistband. This crosses in the back. So that is actually going to put all of the weight of baby on that X in the back, put all that weight in my chest. A lot of women that I've talked to who tell me they wore their first, they didn't like it. It's because they had a carrier like this that put the weight between their shoulder blades where it didn't align with their center of gravity. So as baby gets bigger, this begins to pull, begins to hurt on a cis female body. On a man's body, cis man's body, this can work really well. The other thing that I find is with feeding, because these have internal harnesses, that makes it really difficult to breastfeed in. It's another reason why these have kind of fallen out of fashion in the baby wearing community, because we want to, if a caregiver wants to breastfeed, we're often going to point them towards a carrier that does not have the internal harness. Cis men who aren't trying to chest feed for any reason are not going to need that option. A lot of times I have found that dad identifying caregivers really like a harness. They like the way it loads baby in and out. They like that they can put the carrier on first and then put baby in. They feel more confident. This one is really awesome because what sets the height is that center in the back. You can make this as you can put it as high on your body as you want. And this allows even a very tall caregiver to have baby in that high position where you can monitor their breathing and you can monitor their positioning. So Bjorn makes one, Infantino makes them. They're very, very easy to find at consignment shops. You probably know somebody who's got one in their closet somewhere that they're not using. So if you are looking for a carrier, especially for a small infant, then these narrow-based carriers, harness carriers, are a really good option to think about. I'm going to do a whole nother video on the narrow base and the hip dysplasia and all of that. So, but for this video, don't worry too much about that. So that is one. Now, another option that can work really well for men is the new On Behemoths. For a small baby, you're going to want to get one, make sure that you get one that's adjustable. You're going to make sure that you use it according to the manufacturer's recommendations. Again, the nice thing about this is that it does not have a waistband. So this is going to do kind of a similar thing. We're going to put baby in here. We're going to make a seat for them here. Baby is going to sit here, and then we are going to buckle there. So again, On Behemoths, no waist belt. That means they can be adjusted on the torso. We're not as held to the torso length and where it sits on the hips. So the important thing on Bohemos really shine for back carrying once baby's older. There are some on the market that can be used for small babies and have adjustable bottoms, or so make sure that you are using the correct on Bohemo for the size of your baby, and that you're following manufacturer's instructions for these. But that's another one if somebody wants to look into something that is still kind of buckly, still kind of a little bit more structured, but wants to kind of try something a little bit different on Bohemos. Those are an Asian style carrier. So the next one that I love is another Asian style carrier, and that is a made-eye. So a made-eye is a square fabric with 4 sashes. The short sashes go around your waist, the long sashes go around your arms. So the nice thing about a made-eye is that it's not structured like a structure carrier. So you can cinch the waist. If the waist needs to be cinched significantly, you can use a rubber band, a hair tie, something like that to cinch it. What I love about it is even though it has a waist strap, this is adjustable. It does not have to sit on your hips like the soft structure carriers do. So this one can be tied if I'm wearing a really small infant. This one can be tied higher on my waist. I can actually even roll it to make it even shorter. And then these go around here and cross and tie off. So a made-eye is an excellent option. They come in lots of different sizes and brands. This one is a wrap conversion, which I love because it does make it really soft, makes it really pliable. So if I'm looking to wear a smaller baby and I'm wanting to cinch it, it's easier to do that because the fabric is so soft. So a made-eye is an excellent option for men, for dads, and also for any caregiver who the standard soft structure carrier doesn't work. So another excellent option is a ring sling. So these are just a length of fabric that go through a ring. The reason why these are really great for dads is, again, we are not beholden to the carrier sitting on the hips of the wearer. So this can be lower or higher for men or for tall caregivers. And I have a whole video on how to use a ring sling. So if you're wanting to use a ring sling, if you're wanting to use a made-eye, go to those carriers to see specifically how to use them. This one, the thing with a ring sling is you're going to want to look for one that probably has a longer tail, that's a larger size. Some of the carriers, some of them come in sizes, some of them don't. You're probably going to want to look for one that comes in sizes and has a larger size. All that does is how long the strip of fabric is. So this works really well for me. I have a nice tail. If I were significantly taller or differently sized, this one might not work for me. So you want to find one that has a couple of sizes and has a larger size. So I've actually known a few dads who absolutely loved their ring sling. This is one of the ones that I feel like we have to kind of fight with those gender stereotypes, but they come in different colors. There's lots of places that are making them in some really great neutral colors. And I think They are excellent options for dad identifying caregivers. And I have worked with more than one dad identifying caregiver who really loved their ring sling. So that is definitely an option. The last option that I want to talk about is the stretchy wrap. So these are excellent. These are so easy to find. They are oftentimes the ones that are on the registries. And what I like about them is that they are very long. So most of the stretchy wraps are generously sized. And because you tie them yourself, that can be intimidating to get started with. But because you tie them yourself, you can tie them as high, as tight as you need them. And you can position baby where you need baby instead of positioning baby where the carrier wants. And that's the real key for anybody who does not, any caregiver who does not fit into the average cis female body type. You're going to want to look for a carrier with more adjustability and flexibility, and the soft structured carriers may not be the one that you're looking for. There are some brands that sell ones with different waist sizes, that sell ones with different strap lengths, and that can be really helpful. The other option is to find a carrier that has more flexibility. So with these, they simply wrap around. And again, I have a whole video on how to use a stretchy wrap. The important thing is that when you cross this, when you make your first pass, you want to make it around your chest, not around your waist, around your chest. And then when you cross the straps, you want to put that X where you want baby's bum to sit. So for me, that's right in the middle of my chest. If I'm wearing a smaller baby, I'm going to do higher. Larger baby, I'm going to do smaller. Same thing with a wearer. If you're taller, you're still going to want to carry high on your chest. So this gives you the flexibility to tie it wherever you need to tie it to put baby in the correct positioning. So then baby goes in here and this comes up here. So because it has so much flexibility with how you wrap it, this one again is another excellent one for men. So I don't have any of the tactical carriers. There are a couple of really cool looking tactical carriers that I have known dads to like. If you like those, awesome. I love it. Anything that gets more wearers wearing and more babies worn is a good thing in my book. So the main thing that I want to leave you with is wear your babies, wear all the babies, and find a carrier that works for you. And if the first carrier you try doesn't feel right, doesn't make you want to put that baby back in that carrier, then find another one. If you're struggling, reach out and find an educator, find a group, find something, somebody that can help you, find somebody else that's doing it successfully and see if they can help you troubleshoot. And then the other thing that I want is just to empower dads to wear their babies. I have found this to be really helpful in especially new dads feeling confident in their role, feeling connected to their baby. Oftentimes I hear dads talking about not feeling as connected if their partner is breastfeeding. This is an excellent way for the non-breastfeeding partner to attach with the baby and to really feel confident in their role. So please like the video and subscribe to our channel, and reach out at the information below if you have any specific questions. We'll talk to you soon. Wear all those babies. Bye.